National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. Today I want to talk to you about a condition called celiac disease. I actually prefer to call it celiac condition, and the reason behind that is it's one of the few autoimmune conditions that we can 100% control. If you can get rid of the gluten in your diet, you no longer have any disease symptoms. Therefore, it's just a condition. That's why I like to use the term celiac condition. It empowers people to take control of their state of being. So what celiac disease or celiac condition is it's an autoimmune response to a protein found in cereal grains called gluten. Many people have heard of it. It's actually made up of a couple subunits of a protein called gliadin, and they form together to make gluten. So if you can get a blood test to get tested for it. If you have antibodies to gluten, gliadin, or an enzyme called tissue transglutaminase, you're likely a celiac. And so if you have celiac condition, really the best way to treat it is to focus 100%, and I mean absolute 100% no gluten. That being said, if you do this, your disease goes away. This is why it's not a disease, it's a condition, it's a state of being. What it means is you can't have gluten in your diet. Your body produces an abnormal response to this protein. It creates an autoimmune response. Now, personally, I don't even believe that celiac condition is primarily found in the gut. Typically, that is what your doctor will talk about, and that is what they're going to investigate for diagnosis. That being said, that enzyme, tissue transglutaminase, what they want to see before they do a colonoscopy to try and confirm if you have celiac is they want to see if you have antibodies to this enzyme. But if you look up what that enzyme does, it forms the connective tissue that hold the cells of your body together. It's very important. One of the main areas it's found is in the nervous system. It's the connective tissue that holds your central nervous system together. It's the connective tissue that's found in your joints. This is why there's high rates of rheumatoid arthritis and arthritic conditions in celiacs. There's high rates of certain types of mental disorders and cognitive decline that occur in celiacs. There's actually a condition some people have called gluten ataxia, in which case you have neurological deficits that are induced by the ingestion of the gluten protein. So to me, celiac disease is not just an intestinal problem. You don't need to have intestinal symptoms to be evaluated. If you have any type of reaction to gluten, I suggest getting tested to see if you are in fact celiac, and the reason behind that is twofold. One, it's really important that you identify it to ensure that you're then 100% gluten-free in the way you live, right down to body care products you put on your body. You even have to watch like adhesives on envelopes because they can sometimes contain gluten. You know, gluten does not get its name by accident. It's a very sticky protein. It's often an ingredient in adhesives. There's a bunch of environmental places where we can still come into contact with gluten. Therefore, it's important to understand how much does gluten affect you, and if you are in fact celiac, you really want to make sure that everything you do in your daily life, from lotions you put on your skin to adhesives you may be exposed to, are 100% gluten-free. In fact, there's certain medications where gluten is found within the tablet. So if you're a celiac, you have to ensure that even your medication is gluten-free, because that can be one source of basically intoxication with the gluten protein that you may not be aware of. So that being said, you know, celiac disease, it's a very serious condition, but to me, it's one of the most manageable conditions around. One of the things, if you do have it, you want to be aware of is it causes a malabsorption syndrome. So if you have, if you've just been diagnosed with celiac, what you have to understand is it's played a huge role in your health up to this point. And so it's typically caused a lack of absorption of key nutrients. Some of the things I often find are my celiac patients tend to be low in iron, B12, and magnesium. So therefore, I usually recommend if you just get diagnosed, you know, take a few extra nutrients just to help repair any deficits you've already that have already been produced in your body. So if you're diagnosed celiac, I usually recommend supplementing with some iron, supplement with some B12, supplement with some magnesium to repair those deficiencies so your body can heal appropriately. Okay, so that's my opinion on celiac disease. Like I said, to me, it's not just an intestinal condition. It is a systemic condition, and it's a very important one that you get diagnosed, because treatment can actually be as much of a hardship as it may seem to you. The treatment from a medical perspective is simple. It's just avoid gluten, 100%. No ifs, ands, or buts, just 100% avoidance. That being said, if you do get what I say in my household is gluten bombed, if you accidentally ingest some gluten, take an enzyme with a DPP4 activity. That's dipeptidyl peptidase 4 activity. What this enzyme does is it actually breaks down the gluten protein, and this can reduce the severity of a reaction you have if you do get exposed to gluten. So that's just one handy little tip if you are a celiac you can use to help manage your condition. So I hope you enjoyed this video. If you did, please check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.